the league started observing the board meetings of the Marin Healthcare District in 1985 because in 1985 there was a transition from a board that directed the hospital and hired the executive director to leasing out the hospital to a professional management group and letting those people manage and operate the hospital while the district board became only the landlord for the building and the land. That was a major transition, but at the time it seemed important because hospitals were becoming more commercial, much more was done by negotiation, and the board made the decision to move to professional management, as did many, many, many other hospitals in the country. Since 1985, the grand jury has stopped by every couple of years to see what the hospital was doing. The newspapers show up at the meetings when there is a big controversy which makes headlines in the paper. But most people go about their daily lives. They don't think about the hospital very often until they have to pick up the phone, call 911, and wait for the ambulance to come and get them. It's important because the hospital, it's always there. It's a community institution. Nothing could possibly happen to something as important and as big as a hospital. But we are at a point now where major changes will be made, and we don't know whether our hospital will continue to be there as a community institution. The history of Marin General and the healthcare district started back in the 50s when leaders in the community decided to form a district which could build a hospital for Marin residents. The district includes all of the county except Novato, which has its own hospital. A district as a public entity also has taxing power, and if you want to issue bonds, you have to have taxing power. The buildings at Marin General, there are 3 of them. There's the new West Wing, the one you see from the road, which is very modern and has all kinds of modern equipment and facilities. And that's what you see. But there are 2 other buildings that were built in the 50s by this original board. They are just exactly what hospitals were in the 1950s. The rooms are equipped as they were at that time. There's no space for MRIs or X-rays or computer terminals or portable heart monitors or any of the other things that are built into modern hospitals. So if you drive around the back, you may see the buildings that your ancestors felt were very up-to-date hospitals in the 50s.
I did that.
It's quite a different scene.
It certainly is.
Everybody was sort of content to leave those old wings and put all the modern stuff in the modern building until the state of California came along. The state of California noticed that in the Northridge earthquake in 1994, some of the hospital buildings were very badly damaged and became non-functional. Well, what if you have an earthquake that doesn't just damage property, but where there are hundreds and hundreds of real casualties? Do we want California hospitals falling down? The state legislature said, we're going to set a deadline that makes every California hospital bring itself up to current seismic standards. But the legislature, in its wisdom, did what it often does. It said, you have to rebuild your hospital regardless of what it costs you, and we are not going to put a nickel into it. However, if you're not done by 2015, we will close you down. That has made a profound effect on many, many marginal hospitals in the state. They can't raise the kind of money it takes today to build a new modern hospital. The other problem is when you have a statewide mandate, all of a sudden, all the architects get very busy, all the construction companies get very busy, all of the building materials go enormously up in price. And now a hospital will cost maybe 3 times as much as it would have 4 or 5 years ago. And fitting everybody to the same deadline creates major problems. It was that decision by the state that made us move into a new crisis at Marin General Hospital. What do we do with the back lot? Sutter was proceeding to design a new hospital or to retrofit. The staff came in, which they seldom do, but they came actually to the public meetings and said, please don't spend the money to retrofit those old buildings. They can never do what a modern hospital has to do. And during the 5 years it takes you to rebuild them, the patients will be miserable and the staff will be very annoyed. Mm-hmm. And so they made a decision based on the input of the people who work in the hospital every day, the nurses and the doctors, that they wanted to move forward with a modern 21st century hospital. Then Sutter continued to plan the building, went back to the board and said, this is going to cost us many, many millions of dollars, hundreds of millions of dollars to build a whole new building at Marin General. What we'd like to do, our lease runs out in 2015. What we'd like to do is extend that lease long enough so that we get our investment back from Marin General, and we can pay off the funds that built the hospital. The board, or at least the majority of the board at that time, said, no way are we going to extend your lease. We want to get this hospital back and run it ourselves. And you've got to be out of here at 2015. Not only that, you owe us a new hospital. So you get that built, and then you leave. Well,
somebody was dreaming.
Fantasy life. Not long after that, having made their proposal to build a new earthquake-safe modern hospital and been turned down flat by the locally elected board, who wanted more control, they instigated litigation, or they went to court to ask that their lease, if it's not going to be extended, to have it terminated sooner. Mm-hmm. Yeah. After months and months and months of unspeakably expensive litigation, the court resolved the issue that Sutter would leave sometime between July 1st of next year and July 1st of 2010.